Bismillahirrahmanirrahim. Today we will discuss hemostasis. What is hemostasis? Hemostasis is the body way of stopping injured vessel from bleeding. When there is injury to the blood vessel and there is loss of blood from the vascular system, this mechanism becomes activated and it stops the bleeding. Hemostasis is inbuilt mechanism of body which is activated when bleeding occurs, and multiple interlinked steps lead to cessation of bleeding from a blood vessel. This mechanism occurs in sequential steps, not haphazardly, and by these sequential steps the blood vessel is sealed and loss of blood is stopped from the circulatory system. This cascade culminates into the formation of plug that close up the damaged side of the blood vessel, controlling the bleeding. So the end result of this mechanism is formation of plug. There is a plug in the damaged area, and due to this formation of plug, the bleeding from the vessel is stopped. This mechanism is present since the origin of life. The day the life has started, the day this system is present. For million or billion years, this system is present naturally in the blood of a living organism. There are 4 interlinked steps of hemostasis that occur in set order following the loss of vascular integrity. They occur in the first event is vascular spasm. Vascular spasm occur in the first event. Then there is formation of platelet plug and formation of blood clot as a result of blood coagulation. This is the third stage or third step of the cascade which occurred during hemostasis. And the fourth and the final step is growth of fibrous tissue into the blood clot to close the hole in the vessel permanently. Here we will discuss that what are the mechanisms and keep it in a liquid form or in liquid status. Actually, platelets like to stick the endothelial lining. These are the platelets. They like to stick the endothelial lining. Suppose this is a blood vessel and it is its endothelial lining. So the platelets actually like to stick here to the endothelial surface of the vessel and coagulate the blood. But on the surface of endothelium, there are substances which keep the platelet inactive or prevent the adhesion or attachment of the platelet to the endothelial lining. Among them, the first one is nitric acid. The second one is prostacyclin. The other substance is ADP, adenosine diphosphate, which also prevent the adhesion of platelets to the surface of endothelium and dephosphatase. When all these together mix with each other, they prevent the platelet inactive. They prevent the attachment of platelet to the endothelial lining, and in this way the blood remains in fluid status. So normal circulation keep blood in liquid form. Injury cause blood to clot. When there is injury, clotting of the blood occur, and this is just like we put nowadays, as I told you in the previous slide, that this mechanism, the inbuilt mechanism, is present from billions of years. Scientists has prepared this chemical which they put in the tires, a tubeless tire, and when the tire is become punctured and when the air oozes from the tire with pressure, this chemical is activated and stop the loss of air from the tire. In the same way, this mechanism, which is present since the origin of life, prevent loss of blood from the vessel or the circulatory system. There are receptors on the surface of the platelet. These receptors are glycoprotein, and there are factor 1 Willebrand factor, and it is ADP. They are present on the surface of platelets, and they are in inactive form, and they are kept inactive by nitrous oxide, prostacyclin, ADP, and D-phosphatase, and in this way the normal circulation remain in progress or flow. The other mechanism is anticoagulant activity. On the surface of epithelium, a substance heparin sulfate is present. Thrombin 3 is attached to this heparin sulfate. It is activated, and it cut down the clotting factor 9 and 10. These clotting factors are 13 and more in the blood, and they are proteins, and they are responsible for the clotting of blood. Among them, the 9-10 are more important, and this antithrombin 3 is actually responsible for the inactivation of these factors, factor 9 and 10, and in this way the blood remains in liquid form. The third mechanism of anticoagulant activity is again on the healthy endothelial surface. Thrombin modulators and other substance which is called thrombin modulator is present, and when the antithrombin 3 attached to this thrombin modulator, it activates the factor C, a protein C. And this protein C actually inactivate factor 5 and factor 7. So these are the mechanisms by which blood is prevented from coagulation. There are some terminologies which we'll come across through this lecture. One is coagulation, the other is platelet adhesion and platelet activation, platelet aggregation and platelet plug, secondary hemostatic plug and clot, and the last one is thrombus. Talking about the coagulation, coagulation is the solo property of plasma. It means that if we remove all the cells, the RBC, the WBCs, platelets, plasma has capability to become clot. During coagulation, a network of cascade reaction is activated by which soluble fibrinogen is converted into insoluble fibrinogen strands. So these are it is also occur in sequence. In sequential order, it is not haphazard all the time. When there is a coagulatory process is activated, this mechanism start and end in a sequential order. Now, physical and chemical characteristic of platelets. Because platelets play main role in the hemostatic process, so we must know about the platelet characteristic. Platelets are round or oval disc. They are 2 to 4 micrometer in diameter. We know the size of red blood cell is 7 to 8 micron, but the diameter of platelet is 2 to 4, or half of the diameter of RBC. It is formed in the bone marrow from the hematopoietic stem cell, which is called megakaryocyte, and this is the largest cell of the hematopoietic series cells. So in bone marrow, the platelets are formed from the megakaryocytes, and this production occurs by actually shedding of the platelets from the megakaryocyte. The normal concentration of platelets in blood is between 150,000 to 3 lakh per microliter. In the platelet, cytoplasm contains active factors. Platelet is a very active cell in the body, contain actin and myosin. Actin and myosin lie in the striated muscles, skeletal muscles, and act in the same way. These actin and myosin act in the same way as they act in the skeletal muscle, and they contract the platelets. Residuals of both the endoplastic reticulum and the Golgi apparatus. These residuals of the reticulum and Golgi apparatus that synthesize various enzymes and store large quantity of calcium. In platelets, there are sacs or organelles which store enzymes and calcium. The mitochondria enzyme system that are the third composition of platelets is mitochondria enzyme system that are capable of forming adenosine triphosphate and adenosine diphosphate. An enzyme system that synthesize prostaglandin, which are local hormones that cause many different types of vascular or other local tissue reaction. Prostacyclin inhibit the coagulation, and this prostaglandin activate the coagulation process. An important protein called fibrin stabilizing factor, it is also present in the platelets, and it is responsible for the hemostasis. So we can say that platelet is a very active structure, and its half-life is 8 to 12 days. The RBC half-life is 120 days, and half-life is 8 to 12 days. Here you can see this is the bone marrow in which we have the megakaryocyte, and from this megakaryocyte, which is the largest cell of the hemopoietic series, so by shedding they are produced from the megakaryocyte, and then they are shifted from the bone marrow to the circulatory system. This is the diagrammatic presentation of platelet. Here we have delta granules. These delta granules contain calcium, ATP and ADP, and we have alpha granule which contain von Willebrand factor and fibrinogen. So this delta granules are also called dense granules, and it is also called SAC granule, SAC. So it contains calcium, ADP and ATP. How you will remember this? This is the diameter of the platelet from here to here, and it is 2 to 4 micron. Another diagram of platelets in which I am interested in dense granule and SAC. SAC, it S stands for serotonin, which is present in this dense granule, ADP present in a dense granule, and calcium, it is also present in this dense granule. And the second one is the alpha granule, which contain von Willebrand factor and fibrinogen. Now, mechanism of the platelet plug. How we discuss that? First, platelets are activated, and then at the end they make a plug. So how they make the plug? When platelets come in contact with a damaged vascular surface, platelets change their own characteristic drastically. As I told you that a healthy endothelial lining prevents platelets from activation, but when the endothelial lining or damage, the underlying collagen tissues are exposed, and substances from this tissue are secreted which cause the platelet to activate. And when this activation occurs, there is a drastic change in the platelet characteristic. What are these changes? They begin to swell. They swell up. In the beginning they are small, but when they attach here to the collagen or underlying tissue, they begin to swell up and assume irregular form which with numerous irradiating pseudopodia protruding from their surface. Here you can see that there are multiple pseudopodia which are produced from its surface, and its surfaces become irregular. This is activation of the platelet, normal, then swell up, and at the last it is activated and produce the pseudopodium. The contractile protein contract forcefully and release multiple active factors. When the platelet attach to the collagen of the blood vessels, this is the collagen, and when the platelets attach to it contraction occur in the platelet. As I told you that it contains actin and myosin and cause contraction of the platelet, and by this contraction the platelet release its multiple active factors. As we discussed that in the alpha, they are present in the alpha granules and the delta or dense granules. These substances are ATP, ADP, prostaglandin, fibrinogen, stabilizing factor, and thromboxane A2. They become sticky and adhere to the exposed collagen in the tissue and to a protein called von Willebrand factor that leak into the traumatized tissue from the plasma. Platelets, after contraction, release these substances, and the von Willebrand factor come from the plasma and add into the tissue, and this make the platelet sticky. The ADP and thromboxane in turn act on nearby platelet to activate them as well. Now when ADP is released, this ADP causes activation of the non-active platelets, and the stickiness of these additional platelets cause them to adhere to the original activated platelet. Now there is a difference between aggregation and adhesion. Adhesion means when the platelet adhere to the collagen of the blood vessel, this is called adhesion. And aggregation means when the platelets are activated and attached to one another. Platelets attach with one another, this is called platelet aggregation. And adhesion means when it attach with the collagen of the vessel. Here you can see in step 1 the platelet adhesion to the endothelial lining and the collagen tissue has occurred, and it release its substances from its granule. These substances are ADP, thromboxane, and in this way they activate other platelets, and there is aggregation of the platelets, and it causes formation of the platelet plug. So adhesion when there is attachment between the endothelial lining, activation when after adhesion they are activated, and aggregation when these platelets, the activated platelet attach with one another, and then platelet plug is when many platelets combine together, they make a plug which is called platelet plug. Coagulation. So now we know that coagulation, platelet adhesion, platelet activation, platelet aggregation, platelets plug, secondary hemostatic plug, and clot, thrombus, and embolus. This we will discuss in the coagulation, and up till now we know these terminologies. Event of hemostasis. There are 4 major events in hemostasis. The first one is vascular spasm. The second event is formation of platelet plug, which we discussed already. The third is formation of blood clot as a result of blood coagulation. This is another process which is activated by the coagulation factor, and these coagulation factors are synthesized in the liver and released into the blood. They are 13 in number, maybe more, but currently 13 are the more prominent and known factors which are given their name according to their discovery. 1, 2, 3 are to their function, like factor, calcium factor, or according to the disease they cause, or according to the name is given according to the scientist name which they discover. So they are 13 in number and they are produced in the liver. Now vascular constriction, how this occur? Trauma to the vessel walls cause the smooth muscle in the wall to contract. When there is trauma, you know that the blood vessel is made of smooth muscle. So the smooth muscle contract. Contraction occur in the smooth muscle of the wall. This instantaneously reduces the flow of blood from the ruptured vessel. When there is contraction, if this is the caliber of the vessel, and after contraction the caliber is become reduced, so there is less blood flow from the vessel. Local myogenic spasm. With damage to the vessel, the surrounding tissues are also damaged, and contraction also occur in the local muscle. So the cell, the vessel wall contraction and the myogenic contraction, the muscle in the vicinity of the damaged area, both cause further reduction in the vessel caliber. Local factor from the traumatized tissue and blood vessels. There are local factors which are released tissue factors and thromboxane, and also the ADP, which we discuss, all these factors are released from the platelets. And the third important event which occur when injury occur to the vessel is stimulation of the nerve at that area. In that area cause pain, and this pain further increase contraction of the muscle in that local area. So in this way the caliber of the vessel is reduced and the loss of blood from the vessel is decreased. More vascular constriction result from local myogenic contraction of the blood vessel initiated by direct damage to the vessel wall, as I told you. And in smaller vessel, the platelet are responsible for vasoconstriction by releasing a vasoconstrictor substances thromboxane A2. A2 is present in the granules of the platelet and they cause vasoconstriction. The more severely a vessel is traumatized, the greater the degree of vascular spasm. When the vessel, more vessels are traumatized, it depends on the area of the vessel. When large area trauma to occur to the large area of the vessel, it causes the more construction of the vessel. Why? Because more is the damage, more is the contraction of the vessel, because more tissues are damaged in this injury. This spasm can last for many minutes or even hours, during which time the process of platelets plug and blood coagulation can take place, formation of the plug. So when the vessel constriction occur, what actually happens? This remain in constricted position, and the platelet aggregation plugging is in progress in this area, and ultimately it cause plug the damaged area, and the oozing of blood from the area or loss of blood from the vessel is stopped. Now Stability of last platelet. To ensure stability of the initial loose platelet plug, fibrin mesh, also called the clot, form and entrap the plug. Here, this first the primary plug is formed. This plug actually it is weak. So for stabilization of this plug, fibrins are formed and they make a mesh around this plug. If the plug contains only platelet, it is termed a white thrombus. And if RBCs or entrapped in this plug, it is called red plug or red thrombus. Clot dissolution. Finally, the clot must be dissolved. First, the clot is formed. Now, we need dissolution of this clot. You know that when the bleeding occurs internally, this is called coagulation, and when it is outside of the blood vessel, it make a clot. So dissolution of this clot is important because we need the flow of the blood. The dissolution of blood occurs through the action of plasmin. Substance is present in the plasma and it causes or it is produced by the clot itself, and this causes dissolution of the clot which is formed. Now blood coagulation, it is another step. The third step or a third mechanism for hemostasis is formed by the blood clot, and it takes 15 to 20 seconds when the injury is severe, and when the injury is minor, it takes 1 to 2 minutes. You may have seen that in motorbike or bicycle accident, or when the wrestler fall on ground and he get injury, bruises on his skin, there is less bleeding because the damage of the vessel is more and the clotting mechanism, the coagulation mechanism start in 15 to 20 seconds. But when there is a sharp cut to tissue, the bleeding is more because the area is less and there is less response to that injury. Less tissues are damaged and less collagens are exposed, so the bleeding remain for a longer duration. You may have seen that if sharp object or sharp cut occur to the tissue, it bleeds for longer time. Activated substances from the traumatized vessel wall, from platelets and from blood protein adhere to the traumatized vessel wall and initiate clotting process. When the platelets attach here in this area, they are activated and they release their activating chemicals. These substances activate other platelets and also activate the coagulation factors, and they cause carboxylation of the protein residual of the coagulation factor. So when there is carboxylation in the presence of vitamin K, when there is carboxylation of the coagulation factors, actually these factors are negatively charged. So when carboxyl group is attached to its surface, they are become positively charged, and then calcium attached to these areas and keep the clotting factor attached to each other. Now within 3 to 6 minutes after rupture of the vessel, if the vessel opening is not too large, entire opening or broken end of the vessel is filled with clot. This is the broken vessel and this is filled with, here is the platelets, plug is formed, and also the plugging and the clotting process, they are running side by side. So also in this area blood accumulate and fill the gap. After 20 to an hour, the clot retract. This close the vessel. Still further, platelet also play an important role in this clot retraction. They contract and reduce its size and fill the puncture or the rupture in the vessel. Fibrine organization or dissolution of the blood clot. How the fibrous organization or dissolution of the blood clot occur. Once a blood clot has formed, it has followed one of the two courses, aggregation of platelets and coagulation. They run side by side. So when coagulation occurs, they take two ways. They adopt two ways. The first way is it can become invaded by fibroblast, which subsequently form connective tissue all through the clot. The vessel has damage, so it can dissolve. The usual course for a clot that form in a small hole or a vessel wall is invasion by the fibroblast, promoted partially by growth factors secreted by platelets. Dissolution occur and also the platelet produce growth factors. So these growth factors activate the fibroblast in the vessel wall and it causes repair of the blood vessel and the vessel is become normalized. This continue to complete organization of the clot into fibrous tissue within about 1 to 2 weeks. Complete repair of the vessel take 1 to 2 weeks. Clot dissolution. Conversely, when excessive blood has leaked into the tissue and tissue clot have occurred where they are not needed, special substances within the clot itself usually become activated. This formation as enzyme to dissolve the clots. When the blood loss is more, it is not needed, so it is dissolved or resolved, and this occur because substances in the blood clot occur and that substances dissolve the clot and remove it from the area. Now I will show you the animation in this. Here you can see the blood is flowing in the blood vessel wall when the endothelial linings are normal. You can see RBC, WBC, and these are the platelets. They are flowing in the blood. When there is damage, here you can see damage has occurred and there is loss of blood from the vessel. This causes exposure of the collagen and it attracts the platelets, and platelets actually adhere to this collagen. Platelet adhesion occur. When they adhere to the collagen, they become activated and swell up and send signals to the plasma and to the blood and activate more platelets, and in this way platelet aggregation take place. This is the platelet plug and stop the bleeding and send signals to the blood to activate the clotting factors, which I told you they are produced in the liver. And these clotting factors then cause the fibrin monomer, make fibrin monomer, and they then deposit on this platelet plug, which is weak in the beginning, and when this fibrin mesh is deposited on it, it is become stable and become more powerful. Now the coagulation take two ways. If here this coagulation not stop, so it will produce and will block the whole blood vessel. On the healthy endothelial surface, we have factors which are released and stop this further propagation of this coagulated blood. So this is inhibited, and fibrinolysin enter into this clot and dissolve it. And the platelets produce the growth factor which activate the fibroblast, and that repair the vessel wall, and at the end we get the complete normal vessel wall. Thank you.